So today we're going to be performing an enema insertion. I would first collect my supplies. So I'll be needing an enema bag, cast-towel soap, concentrate. I'll need lubricant, the waterproof bed pad, the clean gloves, goggles, and yeah. So now we're going to, I would perform hand hygiene now, and then I'm going to fill the enema bag. So we're going to fill it 750 to 1,000 milliliters with warm water. And first, we're going to clamp the bag. So no water gets out. Okay. Okay. So now that that is in there, I would put the soap in, and then I would lightly aggravate the soap in the water to mix it around, and then now I'm going to lubricate the end by unclamping the bag and letting some water go out. So now I will clamp it back. And then put the cap back on and put it on a firm surface. Okay, so now we will be putting on goggles and clean gloves. So I'm going to be putting the patient in the bed to a working height, lowering the side rail and putting them in a left lateral Sims position. At the beginning, I would have also explained the procedure to the patient, and now I'm going to lubricate the end of the enema with my dominant hand. So for today, I'm not actually going to put any lube on, but I would put it here and I would lube 3 to 4 inches. And then I would put my non-dominant hand on their hip, and I would tell them to take deep breaths during the procedure. So now I would lift the buttocks with my non-dominant hand, and I'm going to be inserting the enema 3 to 4 inches. Okay, so not letting go of this, I'm going to take the enema bag and place it 12 to 18 inches above the rectum. So in this procedure, if you have hemorrhoids, you can bear down during the procedure, and I would remove this, or I would clamp or lower the solution if the patient was having any cramping or was uncomfortable, and I would tell them to have deep breaths. Also, I would make sure that now I'm going to be taking out the enema. and I would dispose of this. While I was doing the enema, I would have had it unclamped and I would have let the water go all the way, but you know, for today we won't be. So I'm going to discard of this, and I'm going to put the patient on a bedpan. So the bed, this part of the bedpan would go under the buttocks, this would go towards the thighs, and we would use that for when they are ready to evacuate. We would suggest that they keep the enema in for 10 to 15 minutes, and then so I'm going to take off my gloves now, and I would document the procedure. I'm going to document the type and size of the enema. I would document the time that the enema took place. I would document the color and amount of the stool or what came out of the rectum. And then I would also document the patient's position when we left the patient. And that will conclude.